So let's look at the embryonic development of the respiratory system. Now, when we left the embryo at 4 weeks of development, we had the lateral body folding, which converted the flat 3-layered embryo into a tubular embryo, with the innermost tube, which had been the bottom layer, which had been the endoderm layer. When it was flat, it's still the endoderm layer, but it's now a tube of endoderm running through the embryo from the mouth to the anus. So on this diagram, this tubular structure represents that endodermally lined tube, which we've said is going to be the gut tube. So on this diagram, if we continued upward through this tube, that would eventually lead us to the mouth, and if we continued downward through the tube, it would eventually lead us to the anus. Now, what we see happening here is that there's an evagination from this endodermally lined tube, and the evagination is from the ventral midline of the tube at a point along the length of the tube in the cervical region. So this is the cervical portion of the gut tube, and we have a ventral midline evagination. Recognize that in this diagram, think of it as the embryo not looking directly at you, not standing straight forward, but rather obliquely toward the right. So the ventral midline is here, and we have this evagination. And the name of that evagination is the respiratory diverticulum. So we know that the respiratory system will come from that. And what we see happens is that it evaginates ventrally. It's now in front of the gut tube, and then it descends caudally, heading toward the chest. Remember, this is the cervical region here, so it's heading downward toward the chest, lying in front of the gut tube. So that immediately tells us that the respiratory system, we should expect to see the organs associated with the respiratory system in front of the organs associated with the digestive system. And sure enough, in the neck, we'll find the trachea in front of the esophagus. This also tells us that since the gut tube is lined by endoderm, that means the respiratory diverticulum is lined by endoderm. And so therefore, we should anticipate that the epithelial lining of the respiratory system is going to be an endodermal derivative. And it is. All of the epithelium of the respiratory system is endoderm. So as we go from this first to the second diagram, we see that we've now turned the embryo so it's sort of straight forward. There's the ventral midline still. And we see that this diverticulum, as it has descended in front of the gut tube, heading toward the chest, it has bifurcated into 2 branches. And then as we continue following it, we see that those 2 branches have expanded, dilated at their ends. Those terminal dilatations of the diverticula are called the lung buds or the bronchial buds, and that's what will become the lungs. So we now see fundamentally the entire length of the respiratory system. The upper end, this region will become larynx and trachea. When it divides, it becomes bronchi, and then those divisions become lobar, then tertiary, and then all of the bronchial branches until we finally get to the alveoli at the end. And that entire system is one continuous layer of epithelium, lined by a continuous layer of epithelium, all of which is the same endodermal epithelium that initially evaginated from the gut tube. Now, remember, we keep saying that the epithelium is endoderm. And remember, we earlier said that endodermal cells only give rise to epithelium. So all of the other elements of the respiratory system, so for example, the trachea, which has an epithelial lining on its lining the lumen, but all of the rest of the trachea, the cartilage, the connective tissue, the smooth muscle of the trachea, none of that is from endoderm. All of that is from the surrounding mesoderm. Now, one last point. In order to separate this respiratory diverticulum from the gut tube after it has evaginated, we need to have the edges, these 2 edges of the diverticulum, come together and fuse. Those edges are called the tracheoesophageal folds. So that means in order to separate this tube, which is the respiratory system. From that tube, we need the two tracheoesophageal folds to meet in the midline and fuse. And that's what normally happens. But we've earlier said that when cells are supposed to fuse, or layers are supposed to fuse, sometimes they don't do that perfectly. Sometimes there are defects in the fusion. So if there is a defect in the fusion of the tracheoesophageal folds, that means there'll be a communication between the trachea and the gut tube, or the trachea and the esophagus in this case. So we would call that a tracheoesophageal fistula. So tracheoesophageal fistula is a result of a defect or a failure in the fusion of the right and left tracheoesophageal folds. And on this slide, we can see a fistula right here. This is the esophagus. This is the airway, so anterior is on the right and posterior is on the left. And typically, when you have a tracheoesophageal fistula, you also have a discontinuity or an atresia of the esophagus to go along with it. So you have an atretic esophagus, and very importantly, this communication between the distal or inferior esophagus and the airway allows for the retrograde passage of stomach acid to go from the GI tract into the airway and then be an irritant to the lungs, resulting in pulmonitis and other fairly significant bronchial problems. So that tracheoesophageal fistula, which is a fairly common defect of the respiratory system, is a result of a failure of the fusion of the right and left tracheoesophageal folds. Now, that explains how we get the lungs and the airway leading to the lungs, but what about the pleura? Where does that come from? To understand where the pleura comes from, we have to go back and take a look at this illustration that we looked at earlier when we were creating the three-layered embryo. And at that time, we talked about how cells of the epiblast migrated through the primitive streak and then occupied and created a middle layer of mesodermal cells, which is true. But now let's modify that a little bit. In most parts of the embryonic body, what happens is that that middle layer of mesoderm ends up splitting into two layers. One layer up against the ectoderm and the other layer up against the endoderm. So the mesoderm splits into two layers, and between those two layers, a cavity develops. So we have two layers of mesoderm with a cavity in between. The name of that cavity is the coelom. So the coelom is a cavity within the mesoderm. What will then happen is that the coelom will become subdivided into three portions. And those three portions of the coelom will become the three body cavities, specifically become the pleural cavity, the pericardial cavity, and the peritoneal cavity. So all three of those body cavities are simply subdivisions of the embryonic coelom. For right now, we're going to be talking about the pleural cavity, but later on we'll talk about the others, but they will be fundamentally built the same way. So we have the pleural cavity in here. So we can say that those two layers of mesoderm that are the boundaries of the coelom will be what becomes the two layers of pleura that bounds the pleural cavity. So we have a pleural cavity, which was the coelom, bounded by two layers of pleura, which were the two layers of mesoderm. We see one layer of mesoderm is up against the endoderm. We know that the lungs, the lining of the lungs, is derived from endoderm. So here we have a layer of pleura, a layer of mesoderm, lying on what's going to become the lining of the lungs. So that'll be the visceral pleura covering the lungs. This layer of mesoderm, which becomes pleura, is up against the ectoderm, which is going to become the covering of the body wall. So this will be the pleura on the body wall, so we'll call that parietal pleura. So when we look at this in the embryo, what we see is endoderm, mesoderm, coelom, mesoderm, and ectoderm. And so if we correlate that with the adult structure, we said that endoderm will become lining of the lung, that'll become visceral pleura, that'll become pleural cavity, that'll become parietal pleura, and that'll be the covering of the body wall. So that's the sequence we should expect to see: lung, visceral pleura, pleural cavity, parietal pleura, body wall. So if you just fold this around, as we know the body will do in the 4th week, we then end up having the pleural cavity surrounding the lung rather than just on its dorsal surface, and we end up with the adult with a pleural cavity surrounding the lung. And we said we would expect to see, going from inside to outside, endoderm, which is the epithelium lining the inside of the lungs, visceral pleura on the surface of the lung, then the pleural cavity, then the parietal pleura on the inner surface of the body wall, and the skin ectoderm, or the skin covering the outer surface of the body wall. So it's exactly the same relationship.